Welcome back to the Morning Blend. This Sunday is a VID, a very important date. It is important if you're on Medicare, or you will be soon, because the open enrollment period will be coming to a close.
So what do you need to do right now to save the most money on your plan? And what about the Affordable Care Act? Open enrollment for that is now in full swing. And here to help us and understand it all is Thomas Qualley with Sovereign Select.
So,
hello.
Hi. So you still got you're still sporting the Movember beard, huh?
Yes, it just keeps growing.
Yeah, it's December now. Are you thinking about shaving, or?
I think he likes it.
I'm kind of attached to it.
It's kind of attached to you.
It's hard to shave off, you know?
Just wait till next November and see how long it can grow.
I get the razor really close and it just pulls itself away.
Right, I get that. There's a little not the opposite of attraction.
Right.
Okay, let's talk a little bit about the open enrollment period, because it ends this Sunday, December 7th, for Medicare specifically.
For Medicare specifically, yes.
Okay, so what do people need to be doing right now?
Well, so we'll be working through the weekend. So basically, people need to tie up their loose ends now. If they're not sure if they made the right decisions, or maybe they didn't do anything yet, it's very important to be proactive and really just tie up all the loose ends and make sure that when December 8th hits and they wake up in the morning, they feel comfortable that everything's done.
Okay, so they have a few days left.
Yeah.
But now what about the Affordable Care Act? That's going on right now for enrollment, and you guys have some specialists on hand because that can get pretty complicated, right?
Yeah, so that started November 15th, and you know, for us, we're trying to kind of wrap up the Medicare open enrollment period and then also kind of ease into the Affordable Care Act open enrollment period. And with the Affordable Care Act, I mean, it's only a couple of years, and everything is still pretty new, and things are changing, and insurance companies are adjusting and getting used to their rates and how they're experiencing pricing and whatnot. So,
because you say annual health insurance reviews are now basically part of everybody's future.
That is part of the future. I mean, it is what it is. We're going forward. The Affordable Care Act is in full swing, and so people need to really be active every year to make sure that they're reviewing their plan, making sure they're on the best plan. Networks change, prescription drug cost changes, deductibles change, prices change. So there's a lot more to the Affordable Care Act than even there is to Medicare, and there's so many more plans that are available and so many different companies that will be coming in and out of the markets each year, especially over the next probably 10 years. It's really important to just stay on top of it and make sure that you're reviewing your plans.
Okay, now what about a person who just is turning 65? What do they need to know?
I'm going to jump back to the Affordable Care Act real quick.
Okay.
Yes, we do have a staff on hand in the office, so call in and we can definitely just kind of walk through the steps, go through healthcare.gov with them, or we can go through specific insurance companies individually. It is all based on income, and there are subsidies for people with lower to middle incomes.
Okay.
65. People that are turning 65, they are brand new to Medicare, so they have, even if they were on Medicare disability and they're turning 65, they have a brand new open enrollment period where they can shop around, get educated on Medicare, and find the best plan to fit their specific situation, which is what we do. We're going to educate people on what Medicare is, what plan options are out there, what the details are, and how they fit with Medicare and how they fit with that person's individual situation. And we're going to customize a plan for them.
So when people are new to Medicare, they have what you call that initial election period.
Yes.
And that window, or that period of time, is 3 months, right?
It's 3 months before the month that they become eligible for Medicare, or the month of their birth, and then 3 months after. So it's actually 7 months.
Okay.
And during that 7-month time period, they're guaranteed accepted into any plan that they choose. So they don't have to answer health questions, and they cannot be denied.
All right, when someone comes to you for help now, what is your planning process with them? What do you sit down and go through?
We're very education focused. So what we're going to do is we're going to educate people on Medicare itself first, because that's really the basis of everything. So Medicare Part A, Medicare Part B, then we're going to go through Medicare supplements and how those integrate and work with Medicare, Part D prescription drug plans, and then Medicare Advantage plans, because that's kind of the whole gamut of what Medicare and people's options are. And so we're going to go through it all, go through the details of each plan, because we're a broker, so we carry pretty much all the plans that are available in the state of Wisconsin. and break down the benefits and show them how they work for their specific situation, whether it's specific health needs, prescription needs, financial needs, what have you. We'll go through that all. And make sure that they have a plan that works.
And because you're an independent broker
yes.
and you represent so many different types of products, not any one specifically,
correct.
Are you paid to endorse or anything like that?
No.
And it's free to people for you to compare plans, to give them advice about what plan is best for them. It doesn't cost them anything.
And you'll even go to their house and sit at their kitchen table and talk with them.
Yeah, we'll go to their house, we'll go to Starbucks, we'll go to McDonald's, you name it. Or we have an office that people can come into, and we have meeting rooms, and we'll sit right there. They look like kitchen tables,
yeah.
which is kind of nice.
That's good enough.
That's fantastic. Here's the phone number to get a hold of Tom and have him compare your plan. Be sure to act now, because we mentioned that the Medicare enrollment period, open enrollment, is coming to an end, but also he can answer questions about the Affordable Care Act. His phone number is 262-641-4111. If you visit sovereignselectins.com, you can find out more online. Great to see you, Tom.
Thank you for having me
Thank
on.
you so much.